Diabetes mellitus in a child. In this case, you are dealing with a mother bringing her child to the GP, usually in the GP. What are the presentations? Weight loss over the last period, frequency, polydipsia as well. All of these are symptoms of diabetes, okay? And in children, if you have a mother who is coming to you concerned about losing weight in a child, just bear in mind four. The first one, cancer. The second one, thyroid. The third one, diabetes. The last one, chronic conditions. Okay, if the patient has any chronic condition, can affect the patient growth and development, then it can affect the weight of the patient. Okay, can cause weight loss. Okay. All right. So these are the main differentials that you bear in mind. Cancer symptoms, thyroid. In thyroid, we usually ask BMW, bowel motion, mood of the child, and W, weather preferences. Okay. Please bear in mind in your examination and investigations to examine the weight and height of the patient, general physical examination, sugar levels, please, sugar levels, beside the other bloods, and urine test. Why do you need to do a urine test, doctors? Urine test in this patient. Why?
To find if there are ketones, DKA.
Ketones, yes. All right. How to know that the patient has DKA? Not only hyperglycemia.
Abdominal pain, fruity smell, drowsiness.
Vomiting.
Okay. And diabetic, ketoacidosis,
Lactate.
ketones, ketonuria or ketonemia, okay, and acidosis. All right. The patient might hyperglycemia itself can cause vomiting and can cause nausea. If any one of us just eats large amount of sugar, he will be nauseous, right? Abdominal pain, or feel like he wants to vomit or throw up. Okay, so usually from the ketonuria and ketonemia, okay, and acidosis. I mean the urine test involve the urine. This is what I want to say to you. Urine test, please. Okay. All right.
Doctor, I'm sorry. What are the differential diagnoses? Diabetes and thyroid and cancer, and what else?
Chronic conditions, chronic medical conditions. You ask any medical condition that the patient has.
Okay.
Yeah. All right. Okay. So in the present history, the patient has weight loss. All right. Tell me more about that. Explore the weight loss. Since when he's losing weight? How much did he lose? Is he on any dieting? So he's a child, to be honest. This is not, even if you skip this question, it's fine. No child is on a diet unless he is, fatty child. Okay, you can ask, you can skip, it's fine. All right. What is his weight now? If she knows. Any specific thing happened before the onset of weight loss? Anything specific happened? No, doctor. All right. Anything else besides this weight loss? Yes, doctor. He's drinking a lot and he's going to the loo more than usual. Oh, well, okay. Okay, this just rings a bell. Okay, this might be diabetes. If she didn't tell you from the start, then you can ask about cancer symptoms, weather preferences, and frequent urination and frequent drinking. Okay. Did it happen before? Any medical conditions? that the patient, the child has, any medication that he is on, any family history of any chronic medical conditions like diabetes or thyroid problems or cancer in the family. These are the main differentials. You can ask about family history of them. But if the patient has frequency and urination, you don't need to ask about cancer. Okay? So just be aware and be minded of what you can ask and what you can't ask. Yeah? Then birds. Birds, what you need to pick up in birds, if the child is 5 years, 6 years, 7 years, 10 years, what you need to pick up in birds?
Development?
Immunization.
Immunization. I'm not going to ask. If I were you, I'm not going to ask about birth, to be honest. In this case, birth is not relevant. Immunization, yes. Development, read book and development, yeah.
And psychosocial.
Social, who is looking after the child, yeah.
Yeah.
Okay. Ideas, concerns, and expectations, and then examine the child. We've told what are the examination points: weight and height, please, and general physical examination, sugar levels, and urine test, please, urine test. Okay. Usually, if it's not DKA, they are not going to show any ketones in the blood, in the urine, and the sugar level should be more than 11 and more, 11 millimole or above. Okay? And this is how to tell that this is hyperglycemia, or the patient might be having diabetes as a child. Okay? So we have two types of diabetes, right? Type 1 and type 2. What usually is the type of diabetes in children? Type 1. Could it be type 2? It could be. How to suspect? How to suspect it's type 2?
Obese child.
Obesity.
Obese child. Yeah.
Obese child and something else. It would be characteristic, to be honest.
Family history.
Well, okay. What else? Acanthosis.
Negligence.
Negligence.
Insolence.
Okay. Yes. Acanthosis, negligence. Okay.
Insulin resistance.
Yeah. Okay. Usually it's type 1 in most of the children, and the treatment should be insulin. Okay. The insulin is injectable, injection under skin. Okay. It will be by pen or pump. Okay. Be aware in this case that it's not easy to tell any mother that her child has diabetes. So don't deal with the case as if it's something normal to tell to a mother. Okay? It's not easy for any mother to know that her child or a part of her heart, okay, has diabetes. Okay? It's part of the diagnosis should be in a sensitive way, or I cannot say it's proper breaking bad news, the child is not dying, okay, but sensitively. Okay, you tell her, well, I can see how you are worried about your child, that he's losing weight. I've examined your child and the blood test as well are with me. Unfortunately, we found that the sugar levels in the blood are higher than usual. And your child might have developed diabetes. Can you see the facial expressions? Can you see the pose? Okay, diabetes. And look at her. Diabetes, doctor, diabetes? What are you talking about, doctor? I think it's anemia. Well, you answer, well, okay, I can see that this is concerning you. It could be anemia, okay? We can wait for the blood, the full blood count to come out, but the sugar levels are showing that your child has very, very high levels of sugar, and this is not normal, and this is an indication of diabetes. Well, doctor, okay, what will happen now? Will he take medications? Yes, he will take medications, but before that he should be assessed by a specialist. Okay? She will have some questions. Answer her questions carefully. Okay? Is it anemia? Well, it could be anemia. The blood test will show that. But from the results that I'm having, his blood sugar is high, and this is an indication of diabetes. Okay, this is the answer of her question. Okay, well, okay, doctor, is he going to take medications? Yes, he's going to take medications, but after the assessment of the specialist. Okay, what kind of medication, doctor? Is it tablet or something to drink? No, it's something called insulin, and usually it's an injection, and it's injectable by pen or pump. Well, doctor, for how long should he take this medication? Well, to be honest, usually in these situations, the treatment will be for life. Oh, doctor, show the sympathy. So it depends on the patient or the mother and her reactions. All right? So what's your treatment usually in this case? If you are in the GP, you send the child to the patient. The child doesn't have DKA. Okay? It's vitally stable, no DKA. The child should be seen, but within 24 hours in the same day, to the specialist. The specialist where they will assess and they will start the treatment. Okay. Usually the treatment is insulin and it's injectable. Okay. From my side, I can teach you now what are the symptoms of very low sugar and very high sugar, how to deal with them. Okay. And also we will need to talk about some lifestyle adjustments in terms of eating healthy, drinking healthy, and having enough sleeping. All of these can help in managing the condition. Okay, so this is how to deal in diabetes mellitus in a child.